Hey everyone, this is Dan Toner with FFP Benefits. I'm the health insurance broker for TESA, Manpower, ATS, and all the your related companies. I'm here to talk about open enrollment. Today is Monday, August 5th. We're going to start open enrollment. I'm going to send everybody an email today with two attachments. One is what you're seeing on screen now, a Word document. That's just a reminder about what open enrollment, the time frame is, how to log into my benefit link. You're going to get an email today that I'd like you to just click on, and it'll bring you right to your portal on my benefit link. That's the site you'll go in and make your elections. If you didn't get it, check your spam, email me, or you can go right to mybenefitlink.com. I'm also have a YouTube on this memo. You'll see a YouTube recording that you can look at to just in case you need to reference that. Also on the screen, you could see the 22-page memo just to tell you about sort of an annual summary about what we're doing. And I'm going to go over that now for you. Some nice big changes. We're going to change to Aetna medical plans. Aetna provides us a bunch of different things that Horizon doesn't. Basically, they were able to get us better coverage at lower premiums with nationwide doctor access. So we certainly like that. Nothing wrong with Horizon, but Aetna can do a better deal. So September 1, we're going to be changing plans. That's why it's important that everyone make their elections before the 16th of August. We are keeping Delta Dental, the premier plan for dental coverage. And we didn't want more carriers. We wanted less carriers. So we're going to just change the vision from Horizon. So we're cutting ties with Horizon Blue Cross entirely. We're going to move vision to Aetna as well. Probably a slightly bigger network of vision providers. Again, nothing wrong with the Horizon plan. It's just we wanted same costs, same benefits, but probably a bigger network of vision providers. So that's why we're changing to Aetna as well. The life insurance and the disability, that renews in October. So even that's part of the package, we're not really changing any of that stuff. Okay. So big news on the, I'm going to blow up a little bit on Aetna. We're offering three different plans. Proposals 2 and 3, sort of 2 is like a silver plan and 3 is like a gold plan. 1 is sort of a brand new plan that Horizon can't even create. So it's out of the box thinking. We're going to start right here in proposal 2. Many of you are on the silver plan. When you go to your primary doctors, 20 for primary, 40 for specialist, that's lower than Horizon. When you go for imaging, it's a $250 copay. The deductible is waived. That's better than Horizon, which is part of the deductible. When you have prescriptions, you have a $3 to $10 generic. That's better than Horizon. And you have a $35 or $50 copay for name brand drugs. That's 50% with Horizon. So we're getting much better prescriptions. Now, hospital and surgery is an interesting one. You have an $1,800 deductible, but then you owe $500 a night at the hospital, $250 every time you have surgery, and the out-of-pocket is $9,100. Here, you have a $3,000 hospital surgery. MRIs are not part of the deductible like Aetna. I'm sorry, like Horizon. And you basically owe $3,000, so that's a slightly higher deductible, but then you owe nothing after the deductible. So we thought this is their version of silver, and it is much better coverage, and again, a lot less premium. So this is why we're using plan number 2. Proposal 3 or plan 3, called the Premier 2000, is basically going to do the same thing, except it's going to lower your hospital and surgery bill, your hospital and surgery deductible by $1,000. So it's kind of like a gold. Proposal 1's an interesting one. Proposal 1 is sort of out of the box thinking. I mentioned it before. There's an $8,150 deductible for a single. And here's what happens, though. You pay nothing for a sick visit to a primary care. That's kind of, you never pay a copay to go to a PCP for your sick visits. You never pay anything to go to an urgent care center. Now, that's not an ER visit. That's the urgent care centers, the Med-Emerges, the City MDs that you see around town. You pay nothing. And you pay nothing for generic drug. Everything else, specialist visits, hospitals, surgeries, MRIs, name brand drugs, are all part of an 8,150 deductible. That means you pay the negotiated rate. Doctor bills this, the Aetna rate's a lot lower. You pay the negotiated rate only up until 8,150, and then you owe nothing for the rest of the calendar year. So it's a catastrophic worst case scenario of 8,150, but a lot of other visits for free. So we thought that was pretty unique. Take a look at the premiums. There's a lot of people that are like, look, I never go to the doctor. I only buy insurance for catastrophic purposes, yet they have 3 free visits, 3 free benefits here with primary, urgent care, and generic drugs. So we thought that was a little unique. And for that reason, we're offering Plan 1. I think you guys can consider it. You're welcome to call me. And just keep in mind, when you buy a plan, you're on that plan until next September, and then you can change. Okay? So I give a little summary down at the bottom of what I just talked about. Delta Dental, no change to the plan. I think they might have raised the premiums like $1 or 50 cents. So very, very small increases. We wanted to keep the Delta Dental plan. And brand new, we are changing to Aetna. This is the same benefits where you can pay a $10 copay to the doctor. You have a copay for lenses, and you get a cash reimbursement plus 20% off for frames, contacts. That's exactly how the Horizon works. The only difference is you're using the Davis Vision network. Horizon didn't have a network, so they rented Davis Vision. Here, Aetna has its own proprietary network. So again, we're going to have Aetna for medical and vision, and then Delta Dental remaining for dental insurance. Those are our carriers moving forward. This is how you look up vision providers. That's the vision plan. Page 9 is when you go to my benefit link, this is how to enroll. You're going to set up your account. Many of you did that last year. You'll come right to step 4. You'll notice you need to click the select button to start. When you click select, you will see your cost to participate in all the medical plans. Click select, and you'll see your cost for dental, and select for vision. Once you hit select, you can enroll to see the premiums or decline. And you can't move on to the next screen unless you've gone through all the select. You hit next, you'll go through beneficiary, which should be on file because of the life insurance part, and you'll sign, and then you'll be done. You have to go all the way through to step 8 to complete the process. The rest of it is just how to get deductible credit. Aetna will give you deductible credit for any hospital, surgery, and MRI that you would have had that $1,800 deductible. This is an example of how to send it in to get credit. So if you met $1,000 deductible, for example, and you go to the Aetna plan, which is the 2,000, 3,000, or the 8,000, they will give you credit for any deductible you met from January up until August 31st. Okay. Counseling, extra legal, financial, life assistance support. These are all the Aetna programs. I encourage you to take a look at each of these documents. Minute Clinic, they are owned by CVS, so there's a lot of enticements, and they have virtual care, primary care at CVS. They also have discounts, and they give you cash. I'm going to go on. There's another flyer that I'm going to be talking about. Let's see, over the counter. Here it is. So this is over the counter. So every 3 months, you'll get $25. So basically, they're going to give you $100 to spend at CVS. You can do it online or in the store. So it's a program because they're uniquely owned by CVS. You can go to any pharmacy for drugs, but clearly they have incentives because of their partnership and ownership with CVS. Let's see. Over the counter, they give you some discounts on over the counter drugs. So this is just really all of the different programs that Aetna offers, including this Health Your Way, a digital health platform. They've taken tremendous sort of strides in the last couple of years with finding and locating providers based on specific needs, and also giving gift cards and a reward center. So take a peek at a lot of their well-being tools. All of these are you get as part of being an Aetna member. And again, if you have any questions on any of this stuff, let me know. Okay, so that just wraps up the memo. So if you guys would take a peek at those emails today, the 5th of August or tomorrow, the 6th. Make sure you get it, log in, make your elections. The sooner everyone makes their elections, the sooner we can approach Aetna and start the enrollment. We can't do it piecemeal. We have to wait for every single employee to finish. Thanks, and have a great day.